Today we are going to talk about fitness during pregnancy. I know there's a lot of confusion out there in terms of should one work out while pregnant and at what level or intensity should one work out during their pregnancy. So let's clear a bit some of these inconsistencies, and thank you for subscribing to my channel. So, before you start any workout while pregnant, it's always advisable that you talk to your doctor, and that includes informing your doctor throughout your clinic days in terms of what activities that you're doing and what intensities you're doing your workouts during your pregnancy. So, what is the recommendations from the doctors in terms of physical activity during pregnancy? So the American College of Obstetricians recommend that women should actually pick up an activity during their pregnancy to maintain some level of activity. While before it was assumed that someone should stay sedentary during their pregnancy, right now it's actually recommended that you pick up an activity before, during, and after your pregnancy. And that is a moderate activity that's done for 30 minutes to 1 hour. And moderate means that you should be able to talk through your workouts. So if you want to test the intensity of your workouts, make sure that if someone was with you, you're able to hold a conversation while doing your workouts. So, why is it important to stay active during your pregnancy? So, one of the reasons is the fact that it does improve the moods during your pregnancy. Pregnancy comes with a lot of hormonal changes that have been associated with mood changes during pregnancy, and some of the consequences of this is that some women also tend to overeat during these mood changes, which can lead to increased weight during pregnancy. And if you maintain some level of activity during your pregnancy, you will see a mood stabilization all through your pregnancy. During my pregnancy with my two babies, I can't remember ever having the mood swings because I maintained some level of activities with both my pregnancies. The second reason is that one of the changes during your pregnancy is that there are hormones that are released that relax the tendons and the ligaments, and with the belly pushing out, it actually increases the curvature on your back. And this can lead to increased back pains during your pregnancy. And if you maintain some level of activity during your pregnancy, you do see an improvement in these backaches. The other reason, for medical reasons, it does help to prevent some things like diabetes that is associated with pregnancy, and hypertension that also comes during pregnancy. So maintaining some level of activity during your pregnancy helps you to avoid some of these complications that come during pregnancy. The other reason is that it does help after your pregnancy. It does help you to come back to pre-pregnancy weight, which is great. Then the other thing is that it has a benefit to your baby. So during pregnancy, there is a recommended or an actual weight gain that is observed among women based on your weight, based on your pre-pregnancy weights. So ensuring that you maintain especially a moderate level of activity during your pregnancy ensures that you remain within the recommended weight gain during your pregnancy, and this can actually have secondary benefits to your baby, because then having a healthy pregnancy without excessive weight gain during the pregnancy, then you give birth to a baby who's within the normal recommended weight during birth. The final benefits, and not just the only benefit remaining, there are so many other benefits, is it does increase your muscle strength during pregnancy, and this is actually a benefit when it comes to giving birth. So maintaining some level of activity during your pregnancy will see you having a very easy birthing process, which is great for you. Then what kind of activities are we talking about that are actually considered safe during pregnancy? So you can do cardio activities, strength, you can do yoga. Some of the workout alternatives that you do have in cardio is brisk walking. Some women actually can jog if they used to jog before pregnancy, and safing is very safe during pregnancy. And if you're going to cycle, I would recommend that you use a stationary bicycle, as opposed to cycling on the streets, where you increase your chances of injury. What options do you have when it comes to strength training during your pregnancy? So you can actually use free weights, but if you're going to be using free weights, I would recommend that if this is your first time working out during pregnancy, do start slow, and that means that don't pick up an activity that is high intensity that you did not do before pregnancy. So the other option that we can actually pick up during pregnancy, because it's very low impact and it's very safe, is the use of tension bands. You can do pretty much most of the strength exercises that a non-pregnant woman can do using the stretch bands. The trick is to check the strength of the stretch bands. Start with the lower strength and build up your strength as you go along. Then the other strength option is to use your body weight, which is very effective in terms of maintaining and building your muscle strength. And this includes things like lunges, squats. You can do the modified push-ups on the wall, or on a chair, or on your falls. Then let's talk about what are the do's and the don'ts while working out during your pregnancy. So what do you need to do while working out while you're pregnant? One of the things is you need to ensure that you do not overheat while you're doing your pregnancy. So first thing, maintain moderate activity during your workouts. The other thing is you have to keep hydrating during your workouts. So always make sure that you have a water bottle with you. Take sips of water as you work out. Take lots of rest if you feel the need to. Make sure that you're working out in a place that you either have a chair or a mat, so that if you feel tired or you need to take a rest, sit down and make sure that you're not overexerting yourself. The other thing is your workout clothes. They need to be loose and comfortable. The shoes that you wear need also to be comfortable. Remember that during pregnancy, there is some water retention, especially in your later weeks of pregnancy, and you might have leg swelling. So this might mean that you need to readjust your shoes, your workout shoes, as you go along, and this also goes for your workout clothing. Then, the other thing is that if you're going to use weights while working out, part of the recommendation is that go lower in terms of what, if you used to use a certain weights in the kgs in terms of your weight, go a bit low while pregnant, and this ensures that you start low, you maintain good form so that you avoid injuries. Remember that during pregnancy there is a hormone that is released that causes your ligaments and your tendons to become loose, and this can lead to instability, especially around your joints. So make sure that you're not overexerting yourself while working out. Then the other thing is that you need to always remember safety first. So in terms of the environment and the equipment that you're using, make sure that safety first. If you have to use a chair to do workouts, make sure that it is anchored so that it's not moving. So put the chair near a wall and make sure that you can push it to the wall so that you don't fall or it doesn't slide off while you're doing your workouts. Then, so what are the don'ts while you're working out? One of the things, like I said, please, during pregnancy, this is not the time to develop new fitness goals. This is a time that you need to maintain or actually pick up an activity just for the benefits that I just talked about. Remember, you have a lot of time after pregnancy to go all in your fitness and to pick up those very challenging workouts, but during pregnancy, like I said, safety first. Then, the other thing is to make sure that after the first 12 weeks of your pregnancy, if you're going to be working out, you cannot lie down chest up for any of the exercises. And that means chest presses, anything that means that you're lying on your back with your chest up. If you have to do any workouts that you need to have your chest up, then it's recommended that you do an incline or an elevated workout. So if you have an inclination bench, you can use that, or you can actually lie down with your arms on your elbows, sorry. Then and remember, as you go up in terms of your pregnancy, so at 12 weeks, at 20 weeks, make sure that you keep on increasing the inclination on your bench. Then the other thing is to make sure that, especially in the last 3 months of your pregnancy, avoid any standing workouts that you have to go above your head. So if you have to do that, any workout, especially overhead presses, and in the last 3 months of your pregnancy, so you can do that while seated, which is pretty safe. The other thing is to change over the exercise. So instead of an overhead press, you can actually do front raises or side raises. Then the other thing that you need to make sure while working out is avoid any activities that involve you jumping off things. So bungee jumping, anything that risks you falling down, that needs to be avoided. Then as usual, you need to make sure that your doctor clears you before any pregnancy workouts. And during your workouts, should you develop any of what we call the danger signs, then you need to stop and you need to inform your doctor. This involves if you start bleeding, if you start leaking fluid, that's the amniotic fluid, if you start feeling faint, or if you start feeling faint, then you need to take a pause in your workouts. You need to inform your doctor. If during any time of your pregnancy you are advised on bed rest, then that is the time to stop working out. So I hope this clears a bit of what is the requirement and what are the recommendations of working out during your pregnancy. Please watch out for my prenatal workouts, which are linked in this video. Subscribe to my channel for more fitness ideas.